Good morning. This is Follow the Science, Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College and principal investigator for the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. I'm also site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, October 31st, 2022. At this stage in the long slog of the pandemic, many of us are foregoing masks in places we previously wore them and getting together indoors when we had previously avoided it. But the holidays throw new variables at everyone's risk calculus. People trek across the country to see each other. Families crowd around dinner tables with older, more vulnerable people sitting beside their younger relatives. As we enter our third pandemic holiday season, some doctors are fearing a seasonal surge in COVID. In Europe, which many experts consider a bellwether for COVID cases in the US, cases are starting to mount, prompting the European Center for Disease Prevention and Control and the World Health Organization to warn that a new wave of infections could be starting. Today, I'm going to talk a bit more about the quickly spreading Scrabble variants of Omicron. Today, I'm also then going to talk about newly announced plans by the World Health Organization for countries to transition to managing COVID-19 as a long-term public health issue. I will follow that up with an overview of new cases, hospitalizations, and deaths. In addition to national and local data, I'm also going to present data on trends in Europe, which has been a bellwether for predictions of future COVID trends in the US. The Omicron BA.5 subvariant is no longer the dominant cause of COVID-19 infections in the United States, according to estimates released Friday by the U.S. Centers for Disease Control and Prevention. Instead, a new sublineage, offshoots of BA.2, BA.4, and BA.5, are now responsible for the majority of new infections in the country. Omicron subvariants BQ.1.1 and BQ.1 are spreading rapidly, according to the data from the Centers for Disease Control and Prevention. The new COVID-19 variants descend from slightly different branches of the Omicron family tree, but they have evolved to share some of the same changes in their genomes that help them slip past our immunity against the virus. The new lineages referred to by many as the Scrabble variants because they contain letters like X and Q that get high scores in the game. The subvariants, which are offshoots of BA.5, were responsible for a total of 27% of infections this past week, according to the CDC. That's up from just 9% of COVID cases just 2 weeks ago. As the pair continues to spread, the prevalence of BA.5 falls. This week, it was responsible for less than 50% of infections, the lowest percentage reported in nearly 4 months. At least two of the Scrabble subvariants, XBB and BQ.1.1, are pretty much unrecognizable to existing antibody therapies and somewhat less recognizable to the antibodies produced by the initial doses of the leading messenger RNA vaccines. In evading some of our therapies, and to a lesser extent, our original vaccines, XBB and its cousins are showing us where the novel coronavirus is heading, generally speaking. The current surge in infections in places like Singapore and Europe is a preview of a potential global surge this coming winter or spring as XBB or one of its relatives becomes dominant everywhere. The good news is that the new bivalent vaccine boosters from Pfizer and Moderna seem to work just fine against XBB, even though the original vaccines are less effective against it. While they won't prevent all infections or reinfections, they should significantly reduce the chance of severe infection, potentially leading to hospitalization or death. Even with immune evasive variants, vaccine protection against what matters most, severe disease, remains intact. We often are so focused on our own situations, we lose track of the fact that COVID is a global pandemic and that the future of the pandemic will rely not only what we do in the United States, but the steps that are going on internationally to prevent and control the virus. So next, I'm going to provide an update on both global efforts and trends. This past week, the World Health Organization launched a new plan for countries to transition to long COVID 19 control. The Access to COVID 19 Tools Accelerator, also called the ACT Accelerator, or for short, just ACT-A, is a 6-month plan for global collaboration to accelerate development, production, and equitable access to tests, treatments, and vaccines. The ACT Accelerator Partnership is operating in a new phase of the pandemic. That is, the pandemic may soon be over, but COVID is here to stay. As the world adapts and learns to live with the virus, countries and the partners that support them have started the transition to long-term COVID-19 emergency work into routine public health and disease control programs, some of which may need to be adapted to take on these additional functions. Given the SARS-CoV-2 virus continues to circulate and evolve, countries will need to maintain capacity to surge in response to future COVID-19 waves while this transition is underway. Developed through a consultative process with ACT-A agencies, donors, industry partners, civil society organizations, and facilitation council members, the plan summarizes areas of focus for the partnership's pillars that include coordination mechanisms and other core functions, and highlights the work to be maintained, transitioned, sunset, or kept on standby. The next phase of ACT-A partners will center on 3 overarching aims. First, focusing research and development and market shaping activities to ensure a pipeline for new and enhanced COVID-19 tools. Second, to secure institutional agreements for sustained access for all countries to COVID-19 vaccines, tests, and treatment, including oxygen. And 3, concentrating in-country work on new product introduction, for example, new oral antivirals for those at highest risk, and protection of priority populations. The ACT Accelerator is the world's only end-to-end solution for accelerating the development of and equitable access to COVID-19 vaccines, tests, and treatments. It's a partnership of many different global organizations, each addressing different areas, but all related to COVID. Much like PEPFAR, the Global Health Organization that was formed to address the HIV pandemic, the ACT Accelerator Partnership has played a key role in facilitating access to COVID-19 countermeasures for low and lower middle income countries throughout the pandemic. To date, ACT-A has provided more than 1.8 doses of vaccines to 146 countries and territories. 2, it has delivered over 160 million tests more than halving the cost of rapid tests to under $1 per test and supplying around 80% of tests used in Africa in the first year of the pandemic. 3, it's delivered over 40 million COVID treatment courses, investing an unprecedented $1 billion US in expanding sustainable oxygen access in low and middle income countries. And 4, it has also delivered over 2 billion items of personal protective equipment, supporting health systems to deliver COVID-19 tools and boosting their laboratory, waste management, and treatment capacities. So many thanks to the WHO and ACT Accelerator for helping protect people across the globe in the fight against COVID. Now I'm going to turn to current COVID trends. Nationally, hospitalizations and known cases of COVID-19 have both been fairly flat in recent weeks, though climbing test positivity suggests that increases could come soon. For both case counts and hospitalizations, modest increases in some states over the past 2 weeks have been offset by modest decreases in others. While few states have seen extreme fluctuations in either direction, these small differences have been enough to keep numbers static at the national level. Nationally, there was an average case count of over 37,000 over the past week. The daily number of persons hospitalized was over 27,000, an increase of 2% over the past 2 weeks, while deaths dipped to 348, a decrease of 3%. Conditions are stable in most states, but there are some concerning trends in the Southwest. In Arizona and New Mexico, both cases and hospitalizations have risen by 30% or more since mid-month. The number of deaths announced each day has fallen steadily, but slowly since September, still remains around 350. In Tennessee, cases have increased by 23% from the average 2 weeks ago to a daily average of 754 cases per day, or 11 per 100,000. Hospitalizations in Tennessee are down 2% to 395 per day over the past 2 weeks, while deaths have increased by 32%. This decrease in hospitalizations and deaths are likely due to the lag between reported cases and outcomes. Test positivity in the state remains unchanged at 11%, but there are now 9 counties with daily average case counts over 20 per 100,000, and 3 counties, including Lake, Unicoi, and Haywood, that have witnessed more than 100% increases in case counts from 2 weeks ago. There is 1 county, that being Unicoi in Tennessee, that is in the CDC's red zone for community COVID level, and 6 in the yellow zone. Counties in the yellow zone include Lincoln in southeastern Tennessee and Carter, Washington, Sullivan, and Hawkins in northeast Tennessee. 88 Tennessee counties remain in the green zone. The percent of the population that has completed the primary series remains at 56%. Tennessee ranks 44th among states for percent of the population fully vaccinated. As we begin to make holiday plans, we need to do so with COVID prevention in mind. Individual risk tolerance may vary among your family members, but in general, plan around the person at your gathering who is at highest risk. That means taking more precautions if you have a family member who is older than 60, on immunosuppressant medications, received a transplant, or is a cancer or HIV patient. This will require everyone who's going to these gatherings to buy into the idea that we're going to do the best to protect each other. The biggest way to protect yourself and others is to stay on top of your shots. The new The new bivalent booster is a critical tool for warding off infection, although many people are not even aware that it is available. You can find the new booster at pharmacies and health centers across the country, and anyone 5 years and older can currently receive it. And keep in mind that you can get your COVID booster at the same time as your flu shot. So for now, this is Dr. Paul Juarez wishing you a good day.